My name is Sarah Jackson. I'm a licensed certified occupational therapy assistant. Biology and anatomy and sociology classes to be going in towards this field. Another big thing that they look at, prerequisites to get into the therapy field, is a lot of volunteer work, just so they kind of get an idea of the work that we do, and it's really an interest for them. An occupational therapist usually does the evaluations, as opposed to the occupational therapy assistant carries out with the treatment plan of the activity and the goals that the OTR addresses from the very beginning with the patient. I became interested when I was in high school. I had a lot of ideas and thoughts, and I initially wanted to become an educator and teach people, but I also was very fascinated by medicine and having the opportunity to help somebody with their health and well-being. So I thought the perfect profession would be occupational therapy, because you kind of get a little of both in there. You're able to teach somebody about their body as well as their health and well-being, and to provide the most independence, and that's what occupational therapy looks for. Oftentimes people do kind of confuse us and think that we are all physical therapy, but physical therapy does work more with mobility training, strengthening, and exercise, where occupational therapy usually takes it one step further. We become a little bit more creative, and we work with the actual patient to be most independent, to be able to go home. So working on their eating and grooming skills, their dressing skills, and how they're going to get to and from places, and to increase their function and mobility to be the most independent as they can be. You have to be very creative in your treatment approaches, especially working with the traumatic brain injury patients, because they come in at different levels. They could be very low level, or for an example, the patient that I was treating earlier, he's at the, he needs a lot of redirection. His focus and attention is very limited, so you constantly have to change your task into what you're doing. So it's very interesting. As they get better, they're able to focus more, and you have a whole different treatment plan. I find it rewarding because of the outcome that we see in our patients, and then when they come back to visit us, the progress that they made throughout our stay and throughout the rest of the stay after they leave the medical rehab center. Working in a medical rehab center in a inpatient hospital, I usually treat patients that ages range from 12 to 97 years old, and it's a very diverse population. I treat traumatic brain injury patients, spinal cord injury patients, stroke, amputee, deconditioning with multiple diagnoses or multiple fractures. And within that day, we usually start like 7:30 in the morning, and we go down to the nursing unit and work with patients on their activities of daily living, such as their grooming and their eating task and their dressing skills. If they're seen in the gym, we work on the gross and fine motor skills. We also reiterate what we worked on in the room to see if they can, remember or retain the information. We also work on visual perception. Right now we have a Wii program that we're working on, where they get to play the Wii, and we incorporate, different upper extremity movements or eye-hand coordination, which is, the technology now is, advancing, so we have to advance our therapies through technology. So we have computer programs that help with visual perception as well. I was involved in the ThinkFirst program, where we go into the schools and we educate about what a brain injury is, what spinal cord injury is. We teach them, what it does to the brain and the spinal cord, and as well as, safety awareness when you're out there playing sports or swimming or, getting involved in different things. It's important not to take risks, because once you're in that position, then it's there for life if you get in an accident, because I see it every day.